Bill and Melinda, great to see you again. I really appreciate you doing this.
Thanks for having us.
So Bill, here we are. Many people are aware that you warned of this in the New England Journal of Medicine and during a TED Talk just a couple of years back. I'm curious why you were able to sound the alarm on this and why we were still so inadequate in our response in this country.
Well, the goal at the time was to get preparedness, to create tools so we'd have quick diagnostics and quick drugs, and that we had done simulations to realize, okay, who is going to take charge? How would we prioritize the testing? Most of that didn't happen, but here we are dealing with it, and not as prepared as we'd like to be, but still a lot of good leadership that's allowed us to moderate what could have been even worse.
Melinda, you have said, as a country, we prepare for war, we prepare for natural disasters. Somehow, we didn't adequately prepare for this.
Yeah, and that's surprising. I will say one of the leaders who did think about this early on and take it quite seriously was Chancellor Merkel. When she had the G7 and she had the leadership of it, they actually did some simulations and some planning. And we're seeing that Germany is one of the exemplar countries in terms of doing some of the right things so that there is less death in those countries. I wish we had done more of that.
There's going to be a lot of time to look back and what we could have done better to prepare for this. And hopefully we're all learning lessons in real time. But let's talk about where we are as a country right now, Bill. What should we be doing right now in the middle of this storm?
Well, we're still in the very acute phase where strong adherence to this social distancing is absolutely key so that we get to the peak and those numbers really start to come down. Within a month or so of hitting that peak, if we put in place the right prioritized testing where the right people are tested and they get quick results, and we have contact tracing, then we will be able to start opening up. But it won't be a totally normal situation until we get a vaccine so that everybody's protected.
We've heard a lot from the president about the 30 days of social distancing. That takes us to May 1st, which is now just a couple of weeks from now. Do you see a possibility of the country reopening in just a couple of weeks, Bill?
Well, the numbers should drive us here. And a group we fund called International Health and Metrics and Evaluation is showing that the numbers are starting to come down. And so, maybe in late May, we'll have 1 per 100,000 active cases because you don't want to shut down again. And, the governors have been good leaders. So that dialogue between the experts and the leaders, I think that's happening now. And our foundation is part of that dialogue.
So what do we need to do right now in order to reopen the country to get back to, some sort of normalcy and sort of set a new normal, whatever the new normal is?
Well, I will say it's 3 phases. The acute phase we're in now, the semi-normal phase until we get a vaccine, and then the truly normal phase after the vaccine has protected all of us. That vaccine is probably late 2021. So the semi-normal period, starting whenever it does, a month, 2 months from now, will be quite long. And the idea, is that involve masks, how dense is the seating at restaurants, and the testing so that you immediately see if you have that exponential rise in any part of the country, and you can go in there and make sure that you isolate and don't get up to a lot of people infected, which would cause a lot of deaths. So fixing that testing regime, there's a lot of dialogue about that, but we need to have that in place before we move to that next phase.
So do you have confidence? I mean, a lot of Americans are going to say, well, wait a minute, we just watched what happened when we really needed the testing in the beginning of this. The testing just simply wasn't there. Are we going to have tens of millions of tests ready in just a few weeks' time to test folks before we try to re-enter society?
Well, the testing will move as we up the capacity so that the people who have the symptoms or have been around somebody who tests positive, they'll get it sent to their home. And so they won't have to go in. And we got the FDA to approve a thing called self-swab, where you don't need a medical person to do that. And it's got still the high accuracy. So that approach, right now, it's a dialogue with the governors. We'll see if the federal government wants to get involved. That will really help with the opening up phase. And it's not just when the government tells us we can go and do things, people are worried. And so they're not going to immediately change their behavior. And yet, if we've really got the right things in place, getting back the economic activity is actually a good thing.
And even this home swabbing, the kits need to come and then you get 24-hour turnaround so you know whether you actually have it or not very, very rapidly. And then, yes, it will mean people doing the right thing and self-isolating themselves. We know the American people can do this. I think it's been really impressive to see how much people, I'll say specifically because we're here in Seattle, but how quickly, as soon as the governor said and the health department said we should all start to work from home, we can see the bridge from our house. There are very few people going across that bridge in a car. And so I think people will need to realize that they need to do the right thing, but I trust that Americans will, but they need the testing.
Yeah, Melinda, I think you're absolutely right. I think Americans deserve a lot of credit in this because they did listen to the warnings and they have stayed home. And I think they're just looking for reassurance now. And I'm struck, Bill, by when you were talking about the phases, the semi-normal phase that you spoke of, that sounded like months and months of that. If a vaccine is still not until 2021, that's many, many months of this new normal.
That's right. It's almost certainly over a year where large public gatherings likely won't be taking place. We're likely to be using masks. Even in restaurants, there'll be some degree of spacing. The Asian countries that saw the disease first are still requiring all of these things. And so we need to learn from them. They've been able to do it without seeing a big rebound, so that definitely is good news. The contact tracing, we have to do that in a way that preserves privacy, because the values we have, and that's very achievable if we put the right system in place behind it.
You've talked a lot about testing here. Let me ask you about testing for antibodies, because a lot of people want to know if there's a chance, they've been exposed to this, perhaps didn't even realize they had COVID-19 or were, as you just said, Melinda, asymptomatic and might have some immunity from this. Are you hopeful that if there are antibodies present, that you will have immunity like we've seen from other viruses in the past?
Well, remember, only a small percentage of the population has been infected. That's the benefit of the isolation we've done. That'll max out at well under 2%. The so-called serology test will have a lot of false positives, and we don't know the antibody level that corresponds to real protection. So, if people are surprised they have antibodies, they may have too few to protect them. So I don't see a huge role for that serology test. It's the highly sensitive viral test that right now you send the swab in to a high volume PCR machine. In the future, even in a few months, we may have a strip test, like a pregnancy test, where you actually get the result at home. That's being developed.
What I'm hearing from you is you don't want a false sense of security from antibody tests in the future.
That's right. It's part of the surveillance to understand the disease, but the idea that somebody then could put themselves at risk, that test isn't going to be strong enough to tell people that.
Bill, we've done so much here on hope surrounding taking the blood, the plasma from patients who've had COVID-19 and who have now recovered. And there's certainly hope that by giving that blood to maybe some of the most severe of patients, that it might help. Do you think that there is science there that says this could work?
We don't know yet, but we have trials that are starting up. And the 6 big private companies that do that blood extraction agreed to work together, come up with a common protocol. So literally within 6 weeks, I think we'll have a sense of that. Of all the drug approaches, it probably has the highest chance of working well. There are dozens of others like the hydroxychloroquine, but this one is the most likely to work, and it will make a huge difference as a therapeutic.
And where do you stand on chloroquine and hydroxychloroquine?
Well, the trial that will actually give us numbers will report out by the end of May. So we, with the University of Washington, have that going on. Until then, we can't say. It's clearly not, like a 80% cure, because in the cases where it's been used, you don't see that much of a differential. But even if it's, a modest benefit, we will find that out through the trial.
A lot of people have been wondering why some people seem to be getting hit much harder with this than others. And Melinda, I know we have to, as a country, not only look at this right now, but certainly try to figure out solutions as we move forward and potentially face something like this down the road. We've seen African Americans in this country and the terrible toll. We've seen here in the New York City area the toll on the Latino community. And I know you're very concerned about that, and you have pushed for that data to be studied.
Yes, we need to have far more data, and it needs to be what we call disaggregated. That is, we need to understand the data by sex, by race, by socioeconomic background, because only when we have data do we know actually how to act as a nation. And so where to apply resources, where we're seeing more disease and we need to make sure that we go there with supplies. We're seeing absolutely higher rates of things like diabetes or hypertension in some of the populations that you mentioned. And so they're being very hard hit. And so we need to make sure we're protecting the very most vulnerable in society. I think one of the things COVID-19 has unearthed for us are the vast disparities in our health system.
I know it's not just our health system, but it's the global health system. And that's where the two of you come in now and have been there really for many, many years. You've been so generous. You've already given $100 million in the fight against COVID-19. And I know that you're announcing right here with me that you're going to give another $150 million. And not only to help fight this here in the U.S., but around the world, and in particular in developing countries. And we're already just beginning to report here on what we're seeing there. The consequences are going to be devastating.
Yes. And so this new $150 million that we are announcing is really to help low and middle income countries, because we're watching the spread of this disease around the world. We're already, again, working with our partners on modeling the disease, but we need to do basically three things. We need to shore up their health systems so they have the protective gear for their healthcare workers, so they have the diagnostic test. We need to one of the things we can do immediately is taking some of our response centers that we've already got going for polio and malaria. We can immediately convert those to COVID-19 response centers. And we're going to have flexible funding for local partners, because we know some of the solutions to these problems are going to come from local partners, because it's not easy to social distance if you live in a home that's one bedroom with 5 people in it, or you don't have access to clean water. So we have to look for local solutions, and we're seeing some of them already in India, and see what ingenious ideas people have that can actually help with physical distancing.
I wanted to ask you, Bill, we've reported here in the last 24 hours, the president revealing that he wants to halt all U.S. aid to the World Health Organization. Do you agree with that move?
Well, I'm hopeful that he doesn't follow through on that, because we need their support. This is a global problem. They are the institution that, brings nations together and makes sure that, that we're sharing best practices between all of those countries. There'll be plenty of time to look back and see which countries did things well, which didn't, where should WHO have done things differently. But we're very supportive of the role WHO plays. They're the ones who helped eradicate smallpox. They, see what's going on globally. And so I hope that doesn't actually happen.
Have you tried to reach out to the president on this?
Well, we did tweet our support for the WHO, and so it's very visible that we see them as a constructive actor, and we don't think they should have to start letting people go in the middle of the first modern pandemic.
I think it's worth saying we've been working with the WHO for over 20 years as a foundation, and no institution is perfect, but it's the global response that's going to get us through this. And WHO was created after World War II to deal with exactly these kinds of issues around the world. So halting funding right now, that just doesn't make any sense.
I did want to ask you about something you said earlier, Bill, the phases that we have to go through. Still, 2021, you said, for a vaccine. You know, Dr. Fauci has mirrored the same thing by saying a year to 18 months. A year is the most hopeful he has been so far. A lot of people listening to this are going to think, well, you know, I'm worried about my parents who are vulnerable, our grandparents, those who have underlying conditions. Does that mean in this semi-normal phase, as you sort of defined it a little earlier, that we're really going to have to keep our distance for many, many months to come to protect the most vulnerable?
I think we have to assume that, we'll follow the numbers. If they get small enough, then you can be more liberal in your behavior. Dr. Fauci's doing a great job. I talk to him regularly, including today, about making sure the U.S. resources and our foundation resources are coming together to accelerate that vaccine. Every month we can get that earlier, it means trillions of dollars. So, this is a key thing, and until then, it won't be totally normal.
And I think we do have to say that as Americans, we have to protect our most vulnerable. And today, the most vulnerable are the aged in this, right? And we need to look at how do we make sure that we're careful. We're going to be careful with we are being careful with our own parents, and we will continue to do that as we go forward until there's a vaccine available.
There's so many questions. I know we're still in the middle of this storm, but people have seen the numbers so far. It appears to be deadlier among men than women. On the flip side, when it comes to women, they disproportionately make up our health care, the front line in this fight, and certainly care at home. And Melinda, I know you've been at the forefront of getting the message out about the incredible role women are playing in fights like this one that we're in right now.
Yeah, 70% of our frontline healthcare workers are women. Women do 2.5 times more unpaid work than men. So they're caring for the young at home, and they're often caring for the elderly. So we need to be more flexible in our paid family medical leave policies than we've ever been before as a nation. We need to have one. And as well, we have to look at the other effects on women around the world during the Ebola crisis. We know in the affected African countries, maternal mortality went up, teen pregnancy went up. We're seeing domestic violence go up in country after country after country. So we need to do things to address that now, because we also know that women are the ones who feed children and take care of them. And so we have to address the specific issues that are happening for women.
And Bill, I know here in the New York City area, the governor has been very cautious, but he has marked these last couple of days a sort of flattening of the curve at a staggering toll, but still a flattening of the curve. We're still waiting for the peak in several other cities and regions in the country. What do you make of, we expected, unfortunately, the most vulnerable, the older Americans within our community to be perhaps hit hardest, but we've seen young people, we've seen very healthy people in their 20s, 30s, and 40s face really difficult cases of this virus. What can you tell us about that initial exposure to the virus, which could determine whether or not you get really hard hit by this?
Well, healthcare workers seem to get larger exposures, and that means some of the younger people, the death rate there has been higher. No one's invulnerable to this disease, either for their own health or spreading it to other people. The good news is that IHME data is saying that the right things have been done. So, death rates as you move into May will be down, and the active cases will get to reasonably small numbers. So, really an amazing effort to do social isolation that puts us in a position to get into that next phase.
But as we open the valve on this economy, don't we have to be, extraordinarily careful not to become so lax on how careful we've all been? Otherwise, we're going to see a spike in cases all over again.
That's right. So we'll start out in a very conservative way. We will wear masks. We won't be close by each other, even in a restaurant. We'll let workers come back as they feel comfortable about doing so. In China now, a lot of workers are coming back, but not all of them yet. So they've done that gradually. And this opening up will be limited by what's wise. also people are going to be conservative. And so the economic activity, will come back gradually. Once we have the vaccine, that can come back fully. But until then, I expect there are things like vacationing or how much people go out that will be quite depressed, but appropriately, because we don't want to get back into this situation we're in today, where the death numbers are over 2,000 per day.
And we're going to have to be incredibly flexible, right? So people who have underlying health conditions or have a family member they live with underlying health conditions, or a grandmother who takes care of the 2 young kids while the single mom in Atlanta goes off to her job, we have to protect that grandmother. So workforces, all kinds of jobs are going to have to be really flexible about who comes in and who doesn't. And our health is our most important thing. And so we have to protect our health while we slowly go back to the economic opportunities that we all have. And we're going to have to take care of families who, their business has gone under, they've lost their job, or they're still struggling to put a meal on the table after the economy starts to slowly open up.
Wow, I'm hearing your message loud and clear. And Bill, you said a vaccine next year. Does that mean the economy, you said could fully come back after a vaccine, but that's a long way off. People have to really be ready here for a very slow and gradual return, while, as Melinda says, reminding themselves that we're all sort of in this fight together. We can't let our guard down, no matter how exhausting this has been.
I do think that we'll figure out how to get school back in, manufacturing, construction, service jobs where you can do the distancing well. So starting that discussion about how do you modify practices so they're safe, now is the time to be talking about that, because, we are, a bit more than a month when this will start to become actionable. But it won't be 100% of the economy, but it won't be anything like what we're in right now, where we're so shut down.
Well, Bill, we should have been listening to you back in 2015. I know a lot of people wish we had heeded the warning a little more closely and been more prepared for this. But I wanted to give you the final word, both of you. Give us some help in empowering Americans in what feels like a very powerless moment. What can we all do? What's your message for us?
Well, there's some great scientists, and every day we're talking to those scientists. What do you need? What are your insights? And so we can get more tests. We can get drugs that will reduce the overload and save lives. There's a lot of promising things there that will come even before the vaccine, like using blood of recovered patients, and then the people with the vaccine.
Yeah, I'd say, to the American people that it's been amazing and remarkable to see the flexibility and the swiftness with which people did the right things based on what the health department was saying. And I think the heroes on this, we all know, and the heroines are the frontline health workers. Our hats are off to them. I wish people could see the science that we're seeing every single day, and the epidemiology and the phone calls from CEOs of big pharma companies. People are coming together to create a global response. Even companies that used to be head-to-head competitors, they are all calling and talking and trying to do the right thing. That's the best of this nation, and I know it's in us, and we are going to get through this. And lastly, I would just say is one of the practices we have as a family around the dinner table at night with our kids is to all go around and say one thing we're grateful for. And I think we can all in this country, even where we're struggling, name one thing every night that we're grateful for.
Yeah, there's no question about that. And I know many in this country are grateful to the two of you and all the work that you've done around the world and right now in this fight. Thank you for all that you're doing.
Thank you, David.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.